My name is Christy Taylor. I am the MOLN Featured Member of the Month. Today, I'm going to take a few minutes and share a little bit more about myself and answer some questions that they've asked me to cover. I have been with MOLN for the better part of the last 8 years or so, and my favorite memory was probably the spring conference that I attended back in 2016 with my then leadership team. That was one place I realized what a great large community of nursing leaders I was a part of, and that I had at my fingertips in the great state of Minnesota and within MOLN. And the network serves as a great support system because everyone is from different backgrounds and can offer different perspectives and experiences. So that's been really great to get to tap into from time to time. It was actually hard for me to pick a favorite memory because each conference is so unique and offers different speakers from both within and outside the doors of healthcare, which I really appreciate. And it also gives me a time to reconnect with former colleagues and even current colleagues, both professionally and personally. So I really look forward to those times. How do I cope with the demanding aspects of my career? Well, I find that every role that I've had has presented different demands and challenges, which is part of why I love it. And always being willing to learn, keeping an open mind, giving grace, and assuming positive intent in others are ways that I approach my daily work, both independently and collaboratively. And I think this has helped me maintain a sense of hope and optimism most of the time, despite a lot that comes my way. I'm grateful every single day to be able to do what I do, and I'm grateful to be trusted as a formal leader. And I've always maintained that perspective since taking my first leadership role in 2013. The perspective really helps me maintain a mindset of gratitude and resilience. In my prior experience, I led inpatient teams, and in my current role, I support procedural teams and leaders. And I've been really fortunate to build a strong network and build relationships with people from both sides, from many different sides of healthcare. And staying connected with that network has been really valuable for me. Knowing how to leverage my own experience and trust the expertise of others has helped build positive team dynamics for the teams that I am a part of and the teams that I have led. And I believe the way I foster those positive team dynamics has enabled effective collaboration and problem solving, and it's made my job a lot easier. A lot of times where it could have been a lot more difficult. So I think the bottom line is knowing that I'm never alone in my work has really helped me have realistic expectations and give realistic expectations of myself and others and give grace to myself and others. In turn, I think this makes responding to the demands of my job a lot more manageable. Who inspires me? Well, those that dedicate their life to serving others inspire me so much. And I think that's why I'm so grateful to be able to support nurses, support staff, technologists, and especially other leaders, because watching their growth, their commitment, their talent is such an honor and inspiring, and it's really an honor to be a part of. Throughout my journey in healthcare, like many others, I've also been inspired by patients time and time again. Um, you can learn a lot from watching people in some of the hardest times of their life and the happiest times of their life, and hearing their stories and being a part of their journeys. And I really think connecting to the core of our work is what helps keep many of us going during the hardest days that we face in our career. What is something that few people know about me? Well, professionally, I don't think many people know that I actually started college to become an interior designer after high school. That was what I was going to do with my life. Early on in that journey, I decided to change course and pursue nursing. My love of leadership actually came when I was in high school, as I fulfilled various shift supervisor roles in my jobs in high school, and that was solidified during my desire to be a leader was solidified when I took my first hospital role as a CNA before nursing school. So, uh, being a leader, a formal leader, was always something I wanted to do. Um, Although the hard days at work make me sometimes think about, what would life be like if I would have pursued design? There's never been a day that I've regretted my decision to pursue nursing or leadership. Um, I have grown so much in the 20 years that I have been in healthcare, uh, and, especially the last 12 years in leadership. I've grown so much personally, probably even more so than professionally, and I think there's not a day that goes by that I am not grateful for the experiences that I've had. So, thank you for taking a little bit of your day to learn a little bit more about me.